This is Dr. Merzine from Aesthetic Dentistry, and I'm going to showcase a patient that was missing a tooth, a lower molar, and as you can see there's a bit of a space between the teeth, and we're going to design this whole case in 3 dimensions. What I've done here is I've scanned with my CREC, which is a 3D CAD/CAM system, and I'm plotting exactly where I want the crown to be placed when I place the implant. So ideally we design exactly where we want the crown to be, and then we have this 3-dimensional x-ray of the patient's jawbone. Here you can see the patient's skull. We can flip it around, see exactly how thick and tall the bone is, and there's a few things we need to look out for. So primarily I'm concerned about where to place the crown, and the implant has to retrofit to that crown. So we'll take a look at the bone that this patient has in the area where the crown's going to go. We can see how thick the bone is, we can measure it, and a few things we need to be concerned about as practitioners. One is the nerve. Here you can see the purple line where I can plot exactly where the nerve goes, and I can verify it in cross-section and move the pink circle onto where exactly the patient's nerve is, so that when I design the placement of the implant, I can make sure I don't come anywhere near the nerve and I'm clear of the teeth that are neighboring this area that's missing the tooth. So once I've done the design in 3D of where I want the crown to be, I import that into the 3D X-ray, and I merge the two data. I bring in the information of where I designed the crown to be, and now I'm going to digitally place where I want the implant to be, keeping in mind that it has to perfectly retrofit to that crown. So here we're looking at in cross-section, the orange is my implant. I'm going to place it right underneath the crown, which is the blue, and the yellow line is where the gum tissue is. So and I can flip the image around on its own axis and verify that my implant is completely surrounded by bone, it's nowhere near the nerve, and it's not touching the teeth that are neighboring the area. From all this information, we've manufactured what's called a surgical stent. What's great about this stent is that it allows me an incredible amount of accuracy and precision. You see this round sleeve within the stent, and all this is adapted to fit the patient's mouth. So we deliver the stent into the patient's mouth, and it seats very snugly on the teeth in the whole arch. And then I can follow that sleeve and place the implant exactly where I had designed it. So I go through a subsequent set of drills that expand the site, and then I go in and place the implant. Here you see the implant that's attached to what's called an implant holder, and I slowly drive that into the area that I created for the implant. And here you can see the final X-ray. It's precisely positioned where I had planned initially. So it's a great revolutionary technique in dentistry to have this much accuracy and precision in placing the implant exactly where we had planned it and designed it to go.